there have been some studies trying to see or to identify if the use of anti-seizure medications after stroke could eventually reduce or protect the patient, have neural protection. However, in the acute setting, the use of anti-seizure medications have shown they do not modify the risk of post-stroke epilepsy on one hand, and on the other hand, they could inhibit or decrease the behavioral motor recovery of the patient. Moreover, some of these medications have cardiovascular effects, and in the setting of post-stroke, you don't want to alter the cardiovascular milieu or the cardiovascular recovery of these patients. So that's in terms of acute symptomatic seizures. In terms of post-stroke epilepsy and more chronic settings, the use of, given that post-stroke epilepsy is considered epilepsy as itself because of the recurrence rate is larger than 60, even 70%, anti-seizure medication is therefore recommended and should be included and initiated as any other patient with epilepsy. There's some emerging evidence that suggests that the type of acute symptomatic seizure could increase or could modify the risk of post-stroke epilepsy. So in the setting of severe seizures, such as status epilepticus, in the acute setting, you could be beneficial to initiate anti-seizure medication therapy and continue it for a long term after the seizure. There are some studies showing that the use of statins, for example, could protect against post-stroke epilepsy. And the way they do it is by protecting the blood-brain barrier, which is a key player or a key factor in the development of post-stroke epilepsy. There's been a recent very large meta-analysis showing that the use of statins, which are widely used in the setting of stroke and cardiovascular health. So in the use of statins could reduce the post-stroke, the risk of post-stroke epilepsy by even 40 to 60%, which is a great deal in this setting.